Hello and welcome to yet another episode of DHL CXO podcast. A successful digital transformation depends on many factors, but perhaps the most critical of them is clinicians. So, what happens when clinicians not only use but embrace technology? That's what we are going to find out today with Dr. Neal Patel, Chief Information Officer at Vanderbilt University Medical Center, Tennessee, Nashville. Dr. Patel is the physician leader at the intersection of clinical care and digital innovation. With over 2 decades of experience in healthcare IT, Dr. Patel has pioneered transformative strategies in artificial intelligence, patient engagement, and healthcare equity. From the ICU to the boardroom, he brings a rare blend of medical insight and technological vision. In this episode, we explore how digital transformation is reshaping the delivery of care, reducing physician burnout, and advancing healthcare equity. We also discuss the global implication of the shift and what health systems around the world, including India, can learn from VUMC's journey. Thank you so much, Dr. Patel, for joining us today on DHL.
Thank you for having me.
Dr. Patel, you have a unique background as both physician and technology leader. You have been associated with Vanderbilt University Medical Center since 1997. Can you walk us through your journey from clinical practice to becoming the CIO of Vanderbilt University Medical Center and what inspired that transition?
Sure. I'm a pediatric critical care physician by training, and I finished training and came to Nashville. Basically thought I'd be doing that, but this was in 1997 when information technology was just beginning to get into the clinical realm. I'd had some experience with computers in healthcare during my training in Los Angeles, where we used the computer for entering physician orders in the inpatient space. And at that time, I was able to witness my leaders ahead of me rebel against the implementation because they felt that the computer was hampering care and could lead to safety issues. So when I got into my subsequent years in training, the information technology department reattempted to get the doctors to use the computer, but this time they actually asked one of us why we didn't want to use the computer, and that was the start of my introduction to being able to translate between the technology world and the clinical world. And during that time, through a partnership, we were able to design the screens, design the workflow so that it actually made sense to the physicians, and we gained widespread adoption. So when I came to Nashville, I did not know at the time that Vanderbilt had an incredible history of developing systems and clinical informatics. And I was just at the right place at the right time and began to help introduce computer technology into the clinical workflow. Started initially by, again, being a naysayer because I would constantly put my foot down and say, this is not coming into our clinical area because it's not good enough. The nice thing about Vanderbilt is instead of casting me out, they actually brought me in and said, okay, explain to us what it would take and what needs to change. And there started my journey. So I've been here for 28 years, and every time there's something new to do. And we have continued from order entry to clinical documentation to workflows to creating data aggregation and visualization tools, and then finally transitioning from our homegrown systems to the Epic platform in 2017. So it's been a long journey, but a really fun journey to be surrounded by brilliant technologists and to be able to work with them to explain healthcare and see how tools need to work.
That's quite fantastic. Dr. Patel, the Indian American community, especially in the healthcare, has had a very significant impact in US healthcare. As one of the prominent Indian American CIO in US healthcare, what has your personal and professional journey taught you about leadership, representation, and the evolving role of diversity in academic medicine?
Sure. I think the biggest thing that it has taught me is that every point of view matters. And especially for me, where I straddle the world between the clinical world, the IT world, and looking at all the different roles, because You can have diversity just within the healthcare team in terms of the different roles, whether it's be the physician, the nurse, the respiratory therapist, the social worker. All of us are involved in the process of care. The pharmacist needs to be able to understand what the physician needs. And so, no matter what aspect you take, all the different people that are involved in the process of care are essential, because at the end of the day, the information technology is about information and communication between individuals. And it's not just between physicians, or it's not just between nurses. We all have to understand each other's world and be open to understanding why somebody else may not understand what one is trying to say. And oftentimes, it can be language, even within healthcare, it can be language between the different roles, because a clinician may refer to some things in one way, whereas a pharmacist may interpret it a different way. So no different than language between ethnicities and between nations within healthcare, and then the language between technologists and clinicians can be completely different. And so understanding that whenever you have conflict or misunderstanding, it's important to step back and listen and seek to understand why the person may have the belief that they have, so that you can find common ground and to find a path forward.
Dr. Patel, like you just mentioned, whenever implementing new digital technologies in a hospital setting, there could be a little initial friction between the technologist and the doctors, the clinical staff. You are a doctor yourself. How has your clinical training shaped the way you approach digital transformation at an institutional level? And do you believe more healthcare systems need physician technocrats leading digital health strategy?
I do think that physicians or clinicians of all types need to be heavily involved in partnering with technologists. I don't know if I like the word technocrat. It sounds negative, but fine, I'll take it for now. But I do think that it is important to have a partnership to understand what the needs are. It is all too often that a brilliant technologist creates a brilliant tool, but it just doesn't work for the clinician, because sometimes our world is not logical. We have ways of doing things because that's how we have been trained for years, and the sequence in which we do things are well worn in our practice patterns. And to understand why that is that way and what we're looking for can really aid in the way technologists can create the tool. Oftentimes, it's not the technology, but it's more often the sequence of things or the presentation layer that can result in disorientation if it doesn't match what the mental model of the clinician is.
Dr. Patel, we have been seeing artificial intelligence and the implementation of AI-assisted, care tools in healthcare. Now, what has been the impact of piloting tools like Nuance DAX Copilot in VUMC, and what are the measurable reductions in physician burnout or documentation overload that you are seeing?
Sure. We actually, just at the start of this year, did an enterprise-wide rollout of Nuance DAX Copilot, and very quickly had over 1,500 physicians attempt to use the tool. And currently, to date, we have about a 42% adoption rate. It's a fantastic tool, but as with any tools, it doesn't work for everybody in the same way. But for those that have found it useful, I hear stories like it's life-changing. It has prevented me from quitting this year, and I can continue on with medicine. We have one of our leaders look at us and say, I always had to go home and finish my work, and now I can go home and play with my kids. I mean, stories like that are profound. Sadly, one of our clinicians reported that this is the first time IT technology has actually helped them. That didn't make me feel very good, because I've been here for 28 years, and obviously this is the first time I've been successful in that person's eyes. But nonetheless, it has been profound for those individuals who were used to taking a lot of time typing, and it wasn't very easy for them, or they may not have been as adept with templates and very, very streamlined workflows. And it's been amazing. We couldn't have predicted which users were going to benefit and which users were not. And the impact that we've seen across the medical center has been amazing. For those who have adopted, we've seen a 50% reduction in looking and using the computer at home instead of at work. So that pajama time, which is a measurable outcome, has been reduced. We've seen a marked increase in closure of the encounter on the same day versus a encounter staying open for subsequent days. And the time spent in the medical record has also been reduced. But all in all, I think the biggest improvement has also been not just for the providers, but the patients are seeing a difference. The patients are excited that instead of the clinician talking to them with their head buried into the computer, the physician is just talking to them as a person and interacting with them with eye contact. And it's really brought joy back to the medicine for a lot of people.
One of the criticism that generally technology in healthcare has is that it might reduce the the touch point between the patient and the clinician. But I think we have to figure out ways in which this this gap can also be bridged.
Absolutely. I think the biggest issue comes down to is if the electronic health record is viewed as a chore and a burden, as an extra activity that distracts, then it's going to always feel like it's getting in the way. If it can be leveraged in a way that it can improve the interaction, make sure that we walk in when we're seeing the patient and actually feel like we're seeing the patient, that we know them already, and that we're there to interact with them because we've already brought ourselves up to speed on who the patient is, what their past issues have been, and what their concerns might be. Oftentimes, that's very hard when you're switching from patient to patient. And if the electronic health record can help you begin to get oriented well ahead of time, then you can personalize that interaction with each patient. And I feel that can be an enhancement.
Right. And that brings me to my next question about patient engagement. I mean, VUMC has been investing heavily in the patient engagement side, from telehealth to digital content hubs like My Southern Health. How are you bridging the gap between digital health innovation and digital health literacy for the underserved populations?
So I think the amazing thing is, even with the underserved, everybody seems to be able to use a smartphone these days. And almost that, well, you may not have a Wi-Fi at home, or you may not have a computer at home, but you can interact with your smartphone. And now that the patient portal is available on a smartphone, we've been seeing incredible level of interaction on that, by not only being able to complete telehealth appointments on a smartphone, which has a much better interface and easy to interact with, but also with information being readily accessible from the patient record. Over the past several years, we have markedly improved our ability to engage the patient, where they can self-schedule for their appointments now, for return appointments across almost all of our specialties, as well as new appointments in many of our specialties. So giving that sort of self-efficacy, instead of having to call a phone number and go through the bureaucracy of trying to schedule an appointment, the ability to be able to do that just on your phone, no different than you would an airline ticket or a restaurant reservation, I think gives that level of self-efficacy and confidence to the patient.
Absolutely. And how has been the response from the patient side for these technologies?
It's been profound. One of the best things about Nashville is it's a small community. And so everywhere you go in town, in your social life, you get feedback on how Vanderbilt is doing. And one of the best things that they talk about is that our patient portal is one that they tout as something that they enjoy, and they feel very connected and in charge of their health record as they continue their journey with us.
Dr. Patel, you mentioned that the community and the people in general, even in the underserved population, the penetration of smartphones is now more than what it used to be. We are moving towards a world of connective digital health. Now, integration of mobile health and wearables through your Center of mHealth Technologies and Digital Genomic Medicine is fascinating. How is VUMC leveraging consumer tech to personalize preventive care and chronic disease management?
Sure. We are beginning to embark on a tool that the Epic platform provides called Care Companion, which, if you're on a journey, the best one is obviously pregnancy, because that's a very defined 9-month journey. And you can start a Care Companion tool, which allows the patient to engage and receive content at different phases during the journey. And we have similar journeys for other chronic diseases or procedures that help you on your way, so that instead of everything being encounter based with a human, you also have the digital engagement through the application at various phases of the process, and that helps you stay in tune. We're also really focusing in as we move forward on how to begin to have physiologic data come from the patient from their home as we move forward. In the research environment, we have the ability to now upload the wearable sensors. You know, everybody's walking around with some sort of device, whether on their wrist or on their ring, that can collect heart rate and sleep patterns and all these other sorts of things, as well as smart measurement devices at home, may they be blood pressures or scales or other sorts of things. We are now able to upload that from the patient's home and smartphone up into our clinical systems here for clinicians to look at. Even though it's ready and the technology is there, we're still doing it on the research side mostly, mainly because ensuring that the flood of data that can come in, how do we make sure that it's accurate? How do we deal with it? So we have several research projects that are looking at that before we move that into the clinical realm.
Right. Dr. Patel, as a thought leader in digital health, how do you see academic health centers like VUMC influencing national health IT policy and industry standards as well? And what is the responsibility that comes with being ahead of the curve?
I think as an academic medical center, we have the good fortune of having a multi-specialty look with a level of inquisitiveness and at times the extra resources that we can apply because of grants and or academic pursuits to apply to actually fine-tune and hone the different tools to truly measure whether they're actually having impact or are they a distraction. All too often, everybody thinks that this tool will have an incredible outcome, but we may not understand the unintended consequences that may happen, whether there is a process that can lead to friction at other parts of the health system that may be unknown to the primary innovator that is pursuing a technology. So I think we have a big role to play in terms of evaluating these technologies and helping fine tune how well to use them and adopt them as we move forward. And then the biggest responsibility is to continue to advocate and educate and help those institutions or health systems that may not be able to have that advantage and help them adopt if they don't have as many resources, and to do that successfully.
Dr. Patel, my last question to you is, as the longtime CIO of one of the best academic medical center in the US, you have been at the forefront of implementing policies and reforms through technology. Now, India has just started, and I believe we are still in a nascent stage of adopting technology in healthcare. What would be your advice for your Indian counterparts for India's healthcare ecosystem? Where do you think India could leapfrog, and what it should adopt from the US?
I think I almost equate this to the way telephony was adopted in India. India basically leapfrogged the landline age because of the lack of infrastructure. So I would basically say be courageous and don't worry about what we haven't had in India, but actually leapfrog now that we have digital tools readily available, just like India leapfrogged into the mobile age rapidly when the technology became available. I do think that now is the time to begin to leapfrog into the advanced IT technology in healthcare. The tools are ubiquitous enough. The key is to make sure that the data and the workflow and processes that clinicians use in the various hospitals become more aligned so that the data can flow more seamlessly as we move forward. But there's no reason that there can't be a rapid ramp up within the healthcare system in India to really keep pace with the rest of the world. And with the innovation that India has and the people power that India has, there's no reason that there can't be incredible advancements.
That's wonderful, Dr. Patel. Just a subset of this question: what are the things that the Indian CIOs, your Indian counterpart, should also avoid while planning their digital transformation?
I think the key is to avoid trying to make it perfect out of the box, because that can take too much time. I believe, just like with startups and venture tools, be rapid. try and experiment and fail quickly, but then also communicate and collaborate with peer institutions so that you can get economies of scale.
Thank you. Thank you so much for this conversation. I think I personally learned a lot from your journey, and all the best for all the new initiatives for VUMC.
Thank you
Thank
so
you so much.
much. Pleasure to be here.